First aid. First aid is the first response or treatment given to someone who has been injured. It is administered before they are transferred to proper medical care. We know that accidents or any circumstances that result to injury really happen unexpectedly and anytime, may it be inside our homes or outdoors. Fortunately, first aid is introduced and made known to take action and assist the injured to prevent the situation from becoming worse, especially if it's severe. Now here are some common accidents and its first aid to know what we are going to do.
Cuts and scrapes are part of childhood. In most cases, they are not serious and can be treated at home. If the wound is bleeding, press sterile gauze or a clean cloth firmly on it until the bleeding stops. Hold the area under cool, gentle running water. You can also use bottled water or saline wound spray. Remove any debris by rubbing gently with a clean cloth or use clean tweezers. Don't apply any disinfecting solutions to the wound. They don't help and will only cause pain. Use a bandage to cover the wound until a scab has formed. Change the dressing every day or more often if it gets wet or dirty. Once a cut or scrape has formed a scab, you can leave it open to the air. If the scrape is in an area that is likely to get irritated or dirty, keep it covered.
If you see someone choking, act quickly. Ask someone to call the emergency services. Stand the person up and begin the 5 and 5 process. First, give 5 sharp back blows between the shoulder blade with the heel of your hand. Keep checking to see if the blockage has been cleared. If not, apply 5 abdominal thrusts. Stand behind them and wrap your arms around their waist. Make a fist with one hand and grab it with the other. Then perform with 5 quick inwards and upward thrusts. Repeat the 5 and 5 process until the blockage has been released.
In the case of a burn, cool the affected area with cool running water as soon as possible for a minimum of 10 minutes. This will reduce the pain, swelling, and risk of scarring. Do not use ice or ice water. Next, cover the wound in cling film or a plastic bag to reduce pain. Do not burst any blisters. If the burn is severe, immediately call the emergency services.
In this video, you will learn to administer first aid to a drowning casualty. Get the casualty out of the water without putting yourself in danger. Depending on the state of the casualty, there are 2 possible scenarios. Scenario 1. The casualty is conscious. Place the casualty in a comfortable position. Cover the casualty and give them some dry clothes. Alert the emergency services, since the victim will have to be examined in all cases. Scenario 2. The victim is unconscious and unresponsive. Lay the casualty on their back. Tilt the head upwards to clear the airways and analyze their breathing. Try to hear or feel their breath on your cheek, or look for any movements of their chest or stomach as a sign that they are breathing. Alert the emergency services. Act according to the casualty's state. This means if the casualty is breathing, place them on their side in the recovery position. Cover and monitor them until the emergency services arrive. If they're not breathing, ask for someone to go and find a defibrillator. While waiting, begin cardiopulmonary resuscitation, altering 30 chest compressions with 2 rescue breaths. If you do not know how to give mouth-to-mouth, only perform chest compressions at a rate of 2 per second. In this video, you will learn to administer first aid to a person who has just broken their arm. Tell the person not to move their arm and to support it without bending or extending it. Use the victim's upper garment, such as a t-shirt or a sweater, to hold the limb securely in one place. This will help to prevent the fracture from worsening. You can also secure the limb in one place with the aid of a scarf. Call the emergency services or a doctor, especially if it's an open fracture, and follow their indications. If the victim is wearing any jewellery in contact with the affected limb, carefully remove it. Do not give the victim anything to eat or drink.